Welcome back to the Better Arizona Show. I'm Sarah Carstrom. Did you know nearly 38,000 people will die of pancreatic cancer this year alone? At Arizona Oncology, patients are getting local access to some of the most current and innovative clinical trials available. I'm here with Dr. Seetharam from Arizona Oncology, and we are talking about pancreatic cancer. And tell people a little bit about that kind of cancer.
So, Sarah, pancreatic cancer is the fourth common cancer if you look at all the different cancers, but it's the fourth common cause of cancer-related deaths. The reason we'll get to it soon, but because when you're getting diagnosed with pancreatic cancer, it is usually pretty late. It's not something we can pick up early because there are no specific symptoms.
But that's what I want to know. How do you know if you have it then?
So these are some of the things which you watch out for. Most of the times it's not easy to pick it up early, but there are some symptoms which if you notice or somebody has it, you have to get it checked out.
Okay.
One is jaundice, which is yellow discoloration of the skin or the white of your eyes. And the reason is that means your liver is not working and it's blocking your bile ducts, which helps your bile salts, which is made in the liver, to get processed through your intestines and absorb the food. The second thing is stomach pain. So everybody just says, oh, it's a little bug. But again, if that is something which is persistent and you're concerned about it, you have to go to the doctor. And the pain, sometimes you can feel it in the back because the mass in the pancreas, it can press on the nerves around that. And that usually causes pain in your back. It's just called referred pain. But something not to ignore. The third one is you lose weight. And you're not intending to. Many people, they're trying to lose weight, but this is not the patient population who are trying to lose weight.
When you all of a sudden realize you're down a significant amount of weight, you haven't changed your life at all, that is something to look for. Now, I talked a little bit at the beginning that there are trials going on underway here at Arizona Oncology that are really making the difference in people's lives that are suffering from pancreatic cancer, and I think that's what people really want to focus in on. Tell me what's going on here.
What we do is integrated patient care for cancer patients. So what we're focused on is trying to get everyone on board. We as medical oncologists work closely with the surgeons, the radiation oncologists, the gynecologic oncologists, and also we have a lot of ancillary services. We have about 43 of the drugs which are currently approved for various different cancers.
And I think that is so huge. So 42 drugs that are now on the market, Arizona Oncology and US Oncology were a part of, and that is just huge because when you're going something like pancreatic cancer, like you said, by the time you're diagnosed, you're pretty far along and it's got a high mortality rate. You're really changing maybe the course of this disease. Now, I want to ask you really quickly, because we are running out of time, someone who has maybe been diagnosed with pancreatic cancer or any kind of cancer, is Arizona Oncology someplace that they could come to no matter what part they are in their treatment and find out if there's a clinical trial that might help them?
Absolutely, yes. So I would urge anyone who was diagnosed with the pancreatic cancer to talk to the doctor or come here and we'll evaluate them for clinical trials if we have one. And if we don't have an appropriate trial, we are fortunate enough to have the Virginia G. Piper Cancer Center where we work very closely, and I work part-time there, wherein we can look at their molecular profile, meaning to say we look at their genes very closely and look if there is a Achilles heel where we can target their abnormality with very specific drugs which are very new, which are not yet approved by the FDA.
Wow, just offering hope here.
Personalized medicine.
Yeah, personalized medicine. People are going to want more information for sure, and you can always go to their website at ArizonaOncology.com, or you can give them a call at 888-972-CURE. And as the doctor said, there are 24 locations throughout the valley. And thank you for your time and information, and thank you for what you're doing here. It's very, very amazing. And the Better Arizona Show will be right back.